So another area, and I'm going to go back to AMD because I talked about wet VEGF inhibitors, but the larger portion of AMD is dry AMD, or geographic atrophy. And I think there's a great opportunity for optometrists here because I spent a lot of time on this, as did you, on the nutraceutical area. And one of the things that I've found not too many people are familiar with is the age-related eye disease study, otherwise known as AREDS, A-R-E-D-S. This was a study carried out by the National Eye Institute where a certain formulation, which was antioxidants and zinc, was in a randomized, controlled way evaluated over a period of 8 years to see whether or not it would inhibit loss of vision related to dry AMD. And in fact, there was a difference. There was a statistical difference between the use of the AREDS formulation and the control. And I think that's big because there is no other treatment today for dry AMD. The nutraceuticals and occupied PreserVision is the actual formula that was used in the AREDS study. And that's something that, number one, optometrists should educate themselves about, should educate their patients about. And as we have this aging population, there's going to be more of them. So that when they see patients who have a family history or a suspect for dry AMD or have dry AMD and want to try and protect the other eye, I think either prescribing or in fact even selling a nutraceutical like PreserVision is a great opportunity.
Now, one question for you there, Brian, is as I've in my past life, as I've interacted with doctors, talking about recommending or prescribing a nutraceutical for a dry AMD patient. There seems to be a lot of resistance. People still eat, despite the AREDS study, saying, well, it's a nutraceutical. There's a how do you get an OD over the hump to make an active recommendation?
Just like I got Bausch and Lomb over the hump. When we first got the AREDS study, there was a lot of discussion, should we even continue to. We acquired the company that had started the study. And then there was a lot of discussion, should we even continue it? We're not in the nutraceutical business. And I remember writing a paper, which I sent out to the whole company, which was basically, was headlined, not just another vitamin. And what I went out and did was explain in relatively short, lay terms, but making it quite impactful, that this nutraceutical is probably one of the only ones that we know of, that there is a randomized controlled clinical trial that shows it has an effect.
Right.
And, so I think that same formula will work for optometry, and I think it's something that ought to be, particularly with young optometrists coming out and looking for opportunities, these patients are going to be, more prevalent. And I think they ought to arm themselves with that information. Number one, to protect the patients. But number two, I think it's a valid area for an optometrist to be actively participating.
Sure. And when you have a therapy like that available and to not recommend it, seems like the wrong decision to make.
Oh, I agree. You're not taking care of your patient to the best of your ability. And the other thing, again, is keeping up with the literature.
Right.
There's another AREDS study going on, AREDS 2. And, that data may be even more compelling in AREDS. There's data on omega-3. Epidemiological data, but it's inferential, and I think people ought to be, looking and being familiar with this kind of data because this is going to impact the patients that you brought up in your question over the next decade.
Okay.
So the other areas which I haven't touched on are dry eye. And, again, with the aging population, we're going to see more dry eye patients. And I think dry eye is an area where there's been a tremendous amount of research. I think if optometrists become more familiar with the research, they will become more familiar with the ways to treat dry eye. And there's a number of different ways which are different from, just, okay, you've got an evaporative condition, I'm going to put a drop in your eye and you're going to feel better. It's much more complicated than that. There's new diagnostic techniques. There's better treatment paradigms, and I think it's incumbent on the optometrist to be familiar with those. But it also presents again an opportunity.
Mm-hmm.
So every time you become more familiar with the disease state and the diagnosis and treatment associated with that, number one, you're doing better for your patients, you're getting more referrals, and number two, there's an opportunity in terms of providing something to those patients that will financially be beneficial.
Mm-hmm.
And then finally, glaucoma. Most optometrists today are treating glaucoma. There's ocular hypertension, which has been shown to be a potential, for turning over into glaucoma. I think the new diagnostic techniques beyond simple tonometry are things that optometrists ought to be looking at. Some of the equipment can be expensive, but I think there's always a way to finance the equipment and basically have a profitable business at the same time taking care of your patients.
On the technology front, one thing we hear from top performing practices is that they like to have the latest technology in their office because it presents themselves as a forward-thinking, progressive practice, which is what the patients want to hear. But it does also provide them the chance to give even better care.
Correct. But investing in state-of-the-art equipment with new technology is a huge practice build. Mm-hmm. It built my practice dramatically in Toronto. And at the same time, you taking care of your patients to the best of your ability. And that, again, leads to referrals. There's no doubt about it.
Sure.
The other area in glaucoma, which I think is critically important, is continuous monitoring of intraocular pressure. And, when IOP is taken today, it's taken at a single point in time, and that's supposed to represent what the patient's experiencing through 24, 48, and so on hours. And that's not the case. That's clear from all of the epidemiological studies that have been done on glaucoma. And that's whether you have ocular hypertension or you actually have glaucoma. And there's new technologies now where, with very simple techniques, such as a contact lens, you'll be able to place it on an eye and measure the intraocular pressure over a 24-hour period or whatever you want to do. Similar to what they do in the cardiac world, where you wear a cardiac Holter monitor to monitor your heart rate and any arrhythmias and so on. We're going to be seeing the same thing in glaucoma.
So what would you say, Brian, are a couple of ways that that young doctor can stay on top of the latest technology and the latest clinical insights?
I think journals are a very good way to do that. Mm-hmm. I think there's online sites like Medscape, where I've been pretty surprised. Medscape in the ophthalmology area is pretty up to date. There's a lot of new stuff. There are other sites on the internet like Biospace, where you'll read about companies, but they also bring technology into the mix as well. And basically, subscribing to some of the journals that go over a broad spectrum of stuff, like Review of Optometry, Review of Ophthalmology, those types of things. You will pick up, what's happening, with new technology. And then going to conferences. I think the conferences are a good place to get a good handle on new technology, and then basically using Google.
All right.
Once you pick up the technology, use Google and make yourself familiar with the technology so that one can educate one's patients.
Okay. Is there one trade show in particular or conference that you'd say, boy, this is the one to go to for understanding the latest technology and emerging therapies?
I think if there was one meeting that had all of that there, but you have to be very selective, is ARVO.
ARVO, okay. So that'd be the one catch-all for most of this information.
But it's not purely a clinical meeting. It's a research meeting.
Okay. Well, thank you, Brian.